Hi everybody, Jenny Guthrie at Glow Medical Aesthetics, talking about one of my very favorite subjects, filler. And I see a lot of misinformation and things out there on filler. So we want to debunk some of those things because honestly, some of the best filler work, you will never know the person has had it done. If you're seeing a lot of filler, and we're hearing about pillow face, we're hearing about filler fatigue and all of these things which really annoy me because I think there's just a lot of misinformation and a lot of bad work out there that is contributing to some of this. So what we want to do is showcase some of the excellent work to debunk some of that out there with really the beauty and the power of the things that we can achieve with filler. Because regardless of what you do, if you decide to do surgery, if you decide to do laser, if you decide just to focus on skincare and those things, as time marches on and the maturing process is happening in your face, if you're not adding filler into those things, you're not going to have as good of a result as you could possibly have. Even if you have surgery, the best surgery on the planet, I guarantee you that you're probably going to need filler within 6 to 9 months. I know, did I say that out loud? Anyway, but literally I've had patients who've had great facelifts and within 6 months we're treating their lips, we're treating their temples, we're working on bone structure issues maybe in the jawline because I'm sorry, surgery is just not going to change your bone structure. And one of the things that we can do with filler is by tweaking areas where we're either losing bone or where the genetics just didn't give it to you and you don't have good support and projection, we can create those things with filler. And so let's not throw the baby out with the bathwater because there's been some bad things or some misconceptions out there. So this lovely patient that I'm showing you, we did a really conservative treatment with her. And no, I did not treat her lips in this visit. Let's just get that out there, because her lips are quite lovely. She's got beautiful shape to her lips, but what was her main issue was her chin wasn't as supportive as of the lower face as it needs to be. And there wasn't a balance between the upper face and the lower face, which then can make the lips look a little unnatural or they're not quite properly supported. So in this lovely patient, we just did a little bit of conservative support in the chin. I think she's probably gonna need a little bit more, but I like to do things kind of in a layered fashion if we have the luxury of doing those things over time. The other thing that we gave her was a little bit of posterior jawline support. Now in a female face, we want to watch where we place the filler so we're not widening the face or making her look more masculine. And we were very conservative with her treatment. I think she needs a little bit more support in my eyes when I see it, just if I was making it perfect or doing what I call full correction. But for her, she was just wanting some improvement. She was wanting to slow the aging process, and she was very happy with the results that we were able to give her with a very conservative amount of filler placed in her face. So in her pictures, even look at her kissy face, how the lips are better supported and the chin is better supporting the animation of the face. So filler isn't just with our face at rest, it also improves how our face moves as we make different faces and as we have different emotional expressions. Those things change over time with loss of structural support. So sometimes in the prejuvenation phase, we're just slowing some of these early aging changes that this patient was experiencing, and she doesn't even look like she's had filler done, but she does look better.